DC Mayor Muriel Bowser revealed today that 75% of the people who have died from COVID-19 in the district were African American or black. African Americans are less than 50% of the city's population. Take a look at this breakdown. In total, 72 people in DC have died from the virus. 54 were black, 2 were Asian, 8 were Hispanic or Latino, and 8 were white. It's a shocking disparity by any measure. Now, earlier today, I talked to DC Councilmember at Large Robert White, who has serious concerns and says leaders just aren't coming up with solutions fast enough. Take a listen.
Well, the city has procured a number of hotel rooms, and the mayor has mentioned this in her press conference, where people who cannot self-isolate in their homes have somewhere to go. What concerns me is that communities of color, we often live, many of us even intergenerationally in the same households. And by the time you show symptoms, you usually have had this virus for a number of days, if not going on 2 weeks. So I worry about the spread. The other concern that I have for our communities, especially the African American community, is when I go to the grocery store, when I look at our bus drivers, when I look at the folks that DPW, folks that we rely on as essential workers, overwhelmingly people of color, overwhelmingly African American. And so I have to believe that has something to do with the rate of spread and the severity of that death rate here in DC.
It sounds like you're heading toward testing. All of these people need to be tested. The sooner the better.
They do need to be tested. Now, the district, like the rest of the states, we have a shortage of testing capability. But I am still trying to explore, and a number of council members are pushing this as well. Are there ways that we can prioritize folks who are dying at such a high rate? So you can't have 75, 76% of the deaths in DC be African Americans, but still have the exact same standard across the board, because that tells us that we're going to continue to see this rate of death if we don't do something different in our testing, in our isolation, and in protection.